Do you know what diabetes is and how it affects our body? Let's dive right into it. Diabetes is a chronic metabolic disorder that's characterized by elevated levels of blood glucose or sugar in the body. When we have more sugar than our body can handle, we're dealing with diabetes. There are several types of diabetes, each with its own causes and symptoms. Type 1 diabetes happens when the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Quite a shock, isn't it? Then we have type 2 diabetes, which is the most common form, developing when the body becomes resistant to insulin. There's also gestational diabetes, which only occurs during pregnancy, but wait, there's more. We also have monogenic diabetes caused by mutations in a single gene, and secondary diabetes, which results from other medical conditions. Now, you might be wondering, how can we tell if someone has diabetes? Recognizing the symptoms of diabetes can be the first step towards getting a diagnosis and starting treatment. The symptoms vary depending on the type of diabetes. For instance, type 1 diabetes, often diagnosed in children and young adults, can cause symptoms like increased thirst, frequent urination, unexplained weight loss, extreme hunger, fatigue, blurred vision, and irritability. Type 2 diabetes, the most common form, shares many of these symptoms but can also include slow wound healing. Symptoms might develop gradually, and some individuals might not notice any signs at first. Then we have gestational diabetes, which occurs during pregnancy. The symptoms can be subtle and might include increased thirst, frequent urination, fatigue, and blurred vision. Regardless of the type, common symptoms include increased thirst and frequent urination. It's important to note that these symptoms can also be signs of other health conditions, so it's crucial to seek medical advice if you're experiencing them. If you or a loved one has been diagnosed with diabetes, know that it's a manageable condition. The key to managing diabetes is early detection and proper management. It's crucial to prevent complications, which can include heart disease, kidney disease, nerve damage, and vision problems. So, how do you manage diabetes? One fundamental component is regularly monitoring your blood glucose levels. This allows you to track your sugar levels and make necessary adjustments to your lifestyle or medication. Adopting a healthy lifestyle is another vital part of managing diabetes. This includes regular exercise, a balanced diet, and maintaining a healthy weight. It's also important to manage stress, as stress can affect blood glucose levels. Lastly, adherence to prescribed treatment plans is crucial. Whether it's insulin therapy for type 1 diabetes or oral medications for type 2 diabetes, following your healthcare provider's advice is paramount. Remember, knowledge is power. Understanding diabetes can help you take control of your health and lead a fulfilling life.